Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
All right, if we could begin with the updates in our regions 4, 6, 7, how is it progressing thus far?
I think it's pretty much the same as we spoke about over the last couple of days. In St. Cuthbert's, we continue to monitor. We're below 20 cases, so that's, as I said before, we have lifted the lockdown, but we continue to monitor the process. At Siparuta, we have 49 cases, and at Oriala, we have 31 cases. So those we continue to monitor as well, and we really don't need, we continue to do more testing and to see whether or not we are getting more positive. But so far, it has been stable.
All right. Yesterday we spoke about New Amsterdam. How is?
New Amsterdam, we still have a number of cases there. We have about 20 cases that we are monitoring, and of course, we're doing contact tracing with those cases. And in Bartica, we have 65 cases. So we had a slight increase in Bartica. About 3 more cases over the last 24 hours.
All right. And previously you'd indicated that all the infrastructure and everything was in place in the region.
Yes, we do have, in every region, we have quarantine and isolation facilities. But in terms of medical care, we have also added capacity at the regional hospital so that each one of these hospitals, if they need to treat COVID-19 patients, that they have the capacity to be able to do so.
Okay. Can I ask you for a quick update on the Ocean View facility now that patients have transferred?
I think so far everything is going smoothly. There are still additional works that we'll have to do as we go. But that would not impede with the management of patients at the hospital. So right now, most of the patients with COVID-19 who would normally be at Georgetown Hospital, we have transferred those patients over to Ocean View. So we have very severe patients. We have 14 persons who are in the ICU, and we have milder patients who are there because they need care. In addition to those patients that we currently have, we are looking at opening up another section of the Ocean View facility so that we can move in the future maternity cases. As it is right now, we don't have that capability right now at Ocean View, but we're working to put that in place. We also would have to build up the laboratory and diagnostic capacity of Ocean View. So that has been an ongoing effort.
All right, you sort of just touched on it a bit, but do we have any critical patients right now at GPHC that require transfer, or generally do we have any critical patients?
The infectious disease ICU that we had at GPHC has literally been moved to Ocean View. So all of our critical patients are now managed at the Ocean View facility because we have been able to put in all the requisite things, medical gas, put in all the ICU beds, monitors, ventilators, and so forth. So all of that is right now over at Ocean View.
All right, Minister, as we wrap up, because we know today is a busy day, it's International Day for Persons with Disabilities. Do you have any particular message you'd like to send?
Well, it is a significant day, and we do have people with a range of disabilities in our society. And one of the things that we have to look at is how we can improve service to this community. And from the level of the ministry, this is something that we have been working on through the Commission of Disabilities, and we have a physiotherapy department that offers a range of service. We would, in the upcoming months, be looking closely at the current programs that we have, do an evaluation, and see how we can expand these programs so that we can provide more service to this community. But ultimately, while we expand services and provide, these things to the community, ultimately it is also about how our society reacts to people with disability. As a society, we must be more civil and caring to persons who have disability, and I think if we're able to do that, if we have more empathy, then it certainly would help, motivate these persons so that they can have a better life in our society. So there are lots of work to be done, because a lot of persons with physical disability and some with cognitive disability still face a lot of discrimination and so forth. And we have to work to change that. And so this here would call for all of us doing our little bit to ensure that we have a society that can better take care of persons with disabilities.
Okay, Minister, thank you so much for speaking with us.
Thank you.
All right, well, that's it for today's COVID-19 update. Remember, of course, we just spoke to the Minister of Health, Dr. Frank Anthony. For more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.